Hello, my name is Colleen Brunetti, and I have been a PH patient for almost 5 years. I am an active volunteer in the PH community, devoting my time to patient networking and support, both online and through my activities with the PHA Board of Trustees. I've been asked to speak with you today about volunteerism. Here in America, our PH Association was built on volunteers. The four women who started the organization worked for several years as a small group, with no financial support from places like drug or pharmacy companies, or even a paid staff to help move things along. As the word spread and more patients were getting diagnosed, and thanks to medications living longer, they started coming together more and more. PHA grew, and all things considered, it grew fast. Now the organization is tremendous. It has about 13,000 registered members, 38 paid staff, and our research program has committed over $11.5 million to support research focused on pulmonary hypertension. Further, the organization provides leadership for countless activities in patient support and awareness-raising initiatives, all because four women got together and volunteered their time to make a difference. Well, that's what we call the big picture. But so much still goes on at a much smaller level as well. For me, volunteering is not only how I give back to the community that has helped me with my PH, it is also how I fight back against PH. When I was first diagnosed, I just sat there, mostly in shock and fear, waiting for something to happen. And anything that could have happened didn't look like it was going to be very good. There wasn't much about PH that seemed positive. I decided I couldn't live like that, just sitting there. So I decided if I had to be in this situation, I was going to make it as positive as possible. I got involved. I started giving my time, and I networked and teamed up with other patients, and we worked together. And you know what? I actually started to feel better. Sure, I still had PH symptoms. I still did take a lot of medication, and I was still scared and uncertain. But I no longer felt that horrible dread and despair. I no longer felt alone. I was making a difference and was better off for it. Other patients tell me they volunteer so they don't feel so alone. They volunteer so that other patients and their families do not have to go through what they did when they felt isolated or were wrongly diagnosed. They say it helps make sense out of a disease that can feel senseless, and that volunteering gives their life a purpose. And then there is the medical side. The side of this that is a part of our responsibility as patients to take care of ourselves, to be our own advocates. As you know, PH is a rare disease, and this means you are likely going to come into contact with medical professionals who don't know a lot about it, and that can be dangerous. It's our job to participate in educating doctors and nurses who have never come in contact with PH about the disease, and it will help in how they treat you, and it might even help them identify a future patient. We have to educate the public. Some people are walking around today getting sick from PH, and they don't even know they have it yet. Others know something is wrong but are suffering under the wrong diagnosis and getting worse by the day. When we educate the public about PH through our volunteer activities like fundraising or contacting the media, we help save lives. Even with all the advancements in screening, diagnosis, and treatment, time is not yet on our side, but there is so much hope. Medical advancements are happening rapidly, in part because patients and those who love them are raising their voices and demanding the research and volunteering their time to help that along, and also supporting each other while we wait. I believe a cure is coming, and we don't know from what corner of the earth it will be. Maybe it will come from an American team, maybe a European team, maybe a Korean team. It's literally a worldwide effort, and I can't wait to see what happens. Thank you for having me speak virtually to you today, and I'm sorry I could not be there in person. I hope your conference today is a chance for you to further your understanding of pulmonary hypertension, network with other patients, and give some thought to how you can help move us to a cure. Have a wonderful day.